think we can go ahead and get started. Okay, awesome. So good morning, attendees, speakers, and faculty. Thank you to each and every one of you for being here today. Today marks the Northeastern University Global Health Initiative's third annual conference, COVID-19 and Racial Equity, or C.A.R.E 2021. NUGI is a group of undergraduate students committed to advancing global health. Although slightly different than what we're used to, we are proud to present an event where you will hear various perspectives, engage in critical conversation, and listen to change makers in the field. And before we begin, we would like to express our sincerest appreciation to all of you who helped make this event possible, specifically the Office of Undergraduate Research and Fellowships, the Institute for Health Equity and Social Justice Research, and our Faculty Advisory Council at Northeastern University. Without you, none of this would have been possible. Honoring Northeastern University's commitment to provide unobstructed access to education for its students, NUGI has organized the C.A.R.E conference to spread awareness about pressing challenges that many face today. This conference will discuss and highlight the racial and health inequities ever present in the United States, yet emphasized through this pandemic. We plan to address our main themes, the COVID-19 pandemic and racial inequity, through a series of guided research talks, panels, and interviews. As the next generation of leaders in global health, we want to speak with more than just words. As such, we have also prepared 4 workshops where attendees can engage and learn from experts working in the field. We will have 2 at the end of today and 2 at the end of tomorrow as well. And in light of the event that took place on Tuesday, the Northeastern University Global Health Initiative condemns any and all forms of racial inequality, including that of our fellow Asian Americans. Although progress has been made in recent years to bring awareness, recent events have demonstrated that there is much work left to be done to make our communities feel safe and accepted. And because NUGI is committed to addressing and discussing such disparities, we recently organized an interview with Dr. Lok Soo, an associate professor of Asian American and Asian Diaspora Studies at UC Berkeley tomorrow from 12:30 to 1:30 p.m. Eastern as part of our C.A.R.E 2021 conference. And we hope you will join us. We will also like to have a moment of silence for the lives that were lost on Tuesday. If you will join me, we will begin now. Thank you. I would like to take this opportunity to hand it over to my colleague, Andrew Lee, who will introduce our first speaker. I hope to see everyone throughout the conference, and please reach out to us or refer to our website if you have any questions. Thank you, and I hope you enjoy the event.
Recently I came across an article in Time magazine titled "America's Long Overdue Awakening on Systemic Racism." And so certainly, I hope these past months have challenged to reflect on these issues, both in our homes and in global health. But we need more than just good intentions to overcome centuries of discrimination. And we can see this in our response to the pandemic. And if we really want to achieve a healthier and more equitable future for all, we need to acknowledge the broader underlying determinants of disease, and most importantly, to listen. And so for our opening keynote, it is my pleasure to introduce Ms. Crystal Lander, who will speak on elevating diverse voices of communities in global health. Ms. Lander is an internationally recognized leader with over 20 years of experience in policy and development. She was recently announced as the Executive Director of Global Affairs at Pathfinder International, where she serves as Director and Ambassador and leads the design and delivery of advocacy campaigns for reproductive, maternal, and child care. Prior to this role, she led the advocacy team at Living Goods, where she also managed the organization's engagement with global health policy. Ms. Lander, thank you for joining us, and it's all yours.
Thank you, Andrew, and thank you to the organizers today. I am really and truly honored to kick off your conference, but also to be a part of such an amazing amazing conference of future leaders in global health. I am so impressed about you all. You all are thinking about and far ahead of where I was at your age and thinking about these issues. And it really makes me feel good that we're going to get it right. We're going to do better and be better in our work. And we really are going to get to the point where we have diverse voices in global health. So first slide. So as I was thinking about this title of Reimagining Global Health, Elevating Diverse Voices, the first thing I thought about is my own journey into global health, what I saw, what I see now in the field, and frankly, what I hope will improve, thanks to all of you all. You are really are challenging the conversations we're having, challenging the leadership structures, the funding, and frankly, even the types of interventions that we have in global health. And that's incredibly important. So when I started college at the University of Michigan, go Blue, I was studying economics. And after, frankly, an incredible study abroad program in the Dominican Republic is where I kind of discovered my love for global health. This program was following a Peace Corps volunteer who was an HIV/AIDS educator. And it was the first time I had been exposed to a Peace Corps volunteer. And I started to understand this impact of individuals on a larger movement. I was introduced to international NGOs as well as to government programs and looked at a lot at the differences on the delivery of health services. And it was also the first time I really looked at or began to understand the role politics plays in health. And I happened just to be there at the time when the Dominican Republic was having elections and the role that colonialism played in the Dominican Republic versus Haiti and those discussions at the time. So it was really kind of this eye-opening awakening for me in the work, but also it led to the foundation of what, frankly, I do today. The next year, I actually applied for a Fogarty grant to spend 5 months in Santiago, Chile, looking at food insecurity. And in one of the photos there, you see the Andes Mountains. And I got to my 21st birthday ski in the mountains of Portillo. And it was a program that was targeted at ethnic minority students to get them interested in global health. Now, one of the things that I kind of noticed later was that a lot of the people who did the program with me and who went to other sites around the world at the time, all were interested in global health, but somehow left global health and ended up focusing on domestic health, which is very important. But I began to think about later, where was the drop off and why so much drop off? And as we, kind of talked to each other later on in our college careers, many of them began to say that it was frankly too hard and too expensive to get the experience that they needed to go into global health. It definitely was a perception that everyone had to do Peace Corps or you had to volunteer somewhere and have the money to back this up. So I considered myself really lucky that I was able to continue my focus on global health and frankly was really encouraged by my professors and mentors to stick with it. And frankly, my family, because without them, I would not have been able to do any of this. So I moved on to Tulane University in their School of Public Health program. And while undergraduate is your time where you get exposed to different things, graduate programs is where you get to dive in and really learn. And that's what I did. Tulane provided me with the opportunity to really understand public health, the good and the bad. But you really got to figure out what was really happening and why. Tulane had a big focus on Asia and Africa and Latin America. And up until that time, I had focused all my time on Latin America. So it was really nice to get some exposure to other parts of the world. I also got to look a lot about service delivery and who delivers those services and why do communities need certain services. I also looked a lot at NGOs versus private sector and who was implementing different programs and why. And frankly, it wasn't until later that I looked around and realized that there were so few people of color in my program. And I thought about what did that mean to our field later on. I also realized that when I was nearing the end of my program and I got to go to Cuba while I was there and study the health system there, where they really challenged you to look at who was involved in health, I really started to think about what job would I have after I got this MPH. I came from a working class family, and for me, that meant a job after graduation. It was not something, I didn't really think about like, what do you do? Up to this point, I was just really interested and able to study the thing I was interested in. But once graduation was coming forth, you started to think about how do people do this work? And it really wasn't, frankly, very clear to me. Now, again, many of the people in my program went on to do Peace Corps. And for me, Peace Corps was a volunteer job. Now, to again set the tone a little bit for what this meant for someone like me, many times, and I only can speak from my experience, but in the Black community, many times we are kind of organized into different categories. So you'll have, best case, the best way I can explain this is from like TV shows. So you'll have families like Good Times, where they live in public assistance, living day by day, and they need services. They are part of the system that way. And then you get the flip side, which people are really familiar with, the Cosby Show family, Black families, where they're upper middle class Black families where maybe volunteering after graduation is what they did. But I would find that most of my friends and people I was in school with were somewhere in between. We were more of a family matters Black family, where we lived day to day. Both of our parents worked, but you went to school to get a job. And public health did not represent a clear job for many of us. And so that was a reason why some of us actually left and went into domestic work, because that is something you could see. You could see working at the hospital or these different things. And frankly, that was what was available. And for me, it was the same thing. I searched for jobs after graduation that paid me. And I did not know how to get into the global side, meaning really working overseas into that work until much, much later. So fast forward, I actually got a job in Houston and was able to start my career in global health with some opportunities there. Now, I will say that the Peace Corps program, and because I bring them up a couple of times already, is doing better with recruiting more students, more ethnic minorities to participate in their program, but it still tends to lean towards upper middle class, even Black students or students of color or people of color, not necessarily remembering that a lot of the working class may be at public institutions, not at private schools. And so many times, again, and this theme will come up in a lot of the things that I talk about, is there doesn't seem to be a clear understanding that there's diversity within communities of color. It seems to be a lot of one or the other, and many of us fall in between. So next slide. But I finally did get to Washington, D.C., which is what I always wanted to do. I wanted to work in Washington because that is the mecca of global health. I mean, New York is New York is nice, but Washington, D.C. is where things happen. That's where the U.S. Agency for International Development is, and a lot of the NGOs are headquartered there. So that's where I wanted to be. And particularly after working in Houston in health, I really wanted to work on health policy. I wanted to figure out, how do you influence how things happen? So I got my first global health job, and it was exciting. I was charged with building a global network for international family planning, which was my love, and something that, back to my days of volunteering in college, was a big part of my experiences. And I was really excited. I quickly recognized that things that we now call microaggressions existed in my day-to-day work, but I don't think I thought about anything as being racist or day-to-day. I did not recognize these things as part of racism. I also knew very quickly that there were few people who looked like me in the rooms and the conversations that I participated in. So I was keenly aware of that. And I was also aware that I was treated differently many times, but I didn't really have words for those. Like I said, y'all are far ahead of where I was at this point in my life. But it was now it's much easier to recognize there are words for these things. I also felt I was lucky. Remember, I told you up to this point, many of my friends dropped out of global health because they couldn't afford it, they couldn't find a job, or they just didn't know where to start. And so here I was working in global health in Washington, D.C. So you didn't feel like you wanted to complain either. So I kept, continuing to do the work that I did, all the time taking note of different things that I saw. And it wasn't until I got to a job where the head of the organization was a Black woman that I recognized how often or not, or how often that didn't happen. And I started to kind of look around and ask questions a little bit more. And I recognized that many of the people at that organization who were people of color in leadership positions have been trained at Africa, which was an organization designed by African Americans for development. And so that had been a training ground for many of them. And I'm talking about in program implementation, business development, M&E, not just, maybe where I was seeing African Americans in jobs, which was, usually operations positions, maintenance positions, administration, the front desk. That's where I would see people of color up until that point in my career. Once I got to this role, I was seeing them in leadership, and it began to hit me the difference. So I will say that that was an important turning point for me. I also noticed that when I went on to my next position, which was again, even a bigger organization and more opportunities, and I noticed that supervisors of color tended to have more diverse teams reporting to them. Now, again, obvious, right? But the reality is that up until that point, I didn't see a lot of supervisors of color. Therefore, you didn't have that diverse of a team. I also thinking about in global health, diversity up until that point in my career had meant men, women. So people would say, we need diversity. That means more women need to be involved. But for a Black woman, I wasn't seeing Black women involved. I was seeing more white women involved. Sometimes women from other ethnicities, but usually it was white women, white men in leadership positions and in the pipeline. I did not see a whole lot of diversity of people of color. I also recognized that when I traveled overseas to see programs and to participate in our global work, staff were recognizing this too. The first time I traveled to Ethiopia in a program at one organization, I literally had staff who walked up to me and were like, "You're Crystal?" And I was like, "Yeah." And they were like, "But you're Black." And I was like, "I am." And they were so surprised because they had recognized the same thing. The people who got to travel to see the work and to see the programs to participate at the country level many times weren't Black, which led to other perspectives of who was interested in this work. And we had a lot of conversations about that. And when it came down to it, it was not that there weren't Black Americans who weren't interested, they just didn't have the opportunities at this level to do that because only people at a certain level many times got to travel. And when it came down to it, it was very few of us who were at a manager level or above to participate. I also began to see that there was a clear cultural incompetence on the differences between an African, an Asian, someone from Latin America, and an African American, an Asian American, and a Latino. And I thought that how interesting it was that these things are just maybe natural when you come from the US and you're a US born person of color. And in the larger community, global health community, the perspective is people of color would be anybody from another country. Well, I had to explain to many colleagues that there is a difference, that an African American and an African have different experiences and bring difference to the table. What I really soon began to understand was for them, it was just like color or no color. It was like white and people of color. Just round up the stage a little bit, make us look diverse and keep it moving. So we weren't seen as bringing values to the conversation. We were seen as diversifying a photo. And that was the difference. And clearly, I was much further along in my career, felt much stronger on speaking up for things that I saw was missing or not valued in a conversation. But it rang true quite often. And in one of the pictures you'll see here, I'm in Geneva and I'm the only person of color in that photo. That was my norm every single day, whether it was a meeting, a conversation, travel, or anything else. That was the norm. As you see at the bottom photos, I was speaking on a panel at Women Deliver at a conference they have. And one of the things that resonated for me in that photo was the conscious decision to have more diversity for at the conference. That was a big conference of people saying, you know what, we want to make sure we have diversity. But when we reflect back a little bit, the diversity was more color than it was understanding the differences. And why isn't the norm to have a panel of all Africans from different African countries, or a panel of all Asians from different countries on a panel talking about something, that would have been seen as so unusual. But it's normal to have a panel of all white Americans or a panel of whether it's women or men talking about issues in Africa or Asia or Latin America. And why is one normal and the other isn't? And then that final photo on the right is at CDC. And that was a group of global health experts coming to visit CDC and to have a conversation. And it was one of the times that we actually talked about the fact that everybody in the room was a US born, who participated was a US born person of color versus from another country. And I remember a side conversation that someone said, I don't see the difference. And I was like, but that's part of the problem, that you don't know that there's a difference and that we have different experiences. And you know, a white British person would be different from a white American or a white Australian. And so it began to have realizing that you're having these dialogues in a different way, but it also, you know, had colleagues who began to understand the positions and the parts they were playing and reinforcing certain things, certain stereotypes around conversations and who adds to those conversations, and frankly, who's not a part of the conversations. So next slide. So what do things look like today? You know, I took you through a little bit of, you know, my history. So it's still rare that there's more than one person of color in meetings and conversations that I'm on. You know, sometimes when it's 2 or 3 of us, we're very excited. But last year was a huge turning point, and not only for our country, but also for the global health community at large. Organizations made statements like the one you see in front of you, calling out racism. It is now normal for people to say, you know, that is inappropriate. We don't like that. We don't support that. And that's not a part of our values. But I will also say, we knew this before. Unfortunately, it took a very tragic, you know, a number of tragic events in the United States over the last year, but it was surprising that it would take this long. Some of us are still a little weary that it will stick, but you all give me hope today. Also, organizations are being called out for their lack of diversity, frankly, for their bullying, poor workplace culture, and this is needed. But frankly, it wasn't a secret. Anything that's been called out recently, we all knew, we all talked about. I remember being a part of a group of Black women who all would meet once a month to talk about how to deal with different microaggressions in our community, because it was more of a support group and therapy group to keep hyping ourselves up and remembering that you are good. And frankly, you're usually more impressive than your colleagues. So don't let them get you down when they are not treating you fairly in the office. It was definitely something that weighed on a lot of people's mental health. And looking back was very, very difficult. And the fact that I needed a support group to participate in certain meetings is, you know, a bit of an issue. But again, this wasn't a secret. This was happening and we knew it was happening. Just now, people feel more comfortable calling it out. There's also more focus on ethnic diversity and just a general interest in making more organizations better, with better recruiting. You see DEI working groups coming up all the time at organizations, and people frankly seeming much more committed to it. You see in the corner there, Hello. Black voices at the Global Health Council put together, the leader of Global Health Council at the time, Lois Pace, which was frankly very bold for her to do. And she particularly targeted Black voices. And there's one panel that is all Black men in global health. And the fact that there's so few and nobody seems to notice, and them telling their stories about what it means and how they feel to be able to participate and speak out. So that was powerful. And it's something that, again, wasn't talked about or done a few years ago. And then you have organizations who are making commitments to, even like the Biden administration, to say, this is what we want to see. We want to see America reflected. And not just in those top line secretary level positions, but at all levels. Because remember, you can't get to the secretary positions or ambassador levels if you don't have a pipeline. And we have to build those things. Now, I will say, for all the good things that are happening and moving in the right direction, we still have some work to do. And we know that based on Tuesday's events. Not all of the work that's happening in the US is being translated. And we're talking about global health, and it's global. And the US is a part of the globe, but particularly for global health, I don't know if it's being translated the same way. Issues of colonialism still are very apparent in a lot of the work that happens overseas. And less than 2 years ago, I know of an incident where a British person, a white woman, made a comment in front of a team of Kenyans because they didn't understand something that was a British reference, that clearly the Britain hadn't colonized Kenya long enough. Now, that would be considered outrageous to say in the US. However, two things occurred to me when that happened. One is it was said and nothing was seen as wrong with saying it. Two, there was no repercussions for it. But three, the people sitting there didn't feel like they had any choices in the matter of even hearing it, and didn't have any choice on what to do after. So it's just a reminder that we still have a long way to go on this work. And for global health, it requires us to look at what we're exporting in our language and what we do, but also as Americans, how we show up overseas and what we see as the standard. It would be great for us to be the standard to say, this is unacceptable. We recognize that our history, and we will do better, and we will have everybody around us do better. And that's what I hope we'll see in the future. Next slide. So this is perfect, all about the future. There are a lot of things I could focus in on, but there are a few that resonate really high for me on things that you all could help change and be a part of the change on, and really take a look at. So the first thing's around communications. We want to tell stories authentically and honestly. And we have the privilege in this field of telling the stories of people who live in low and middle income countries for global health, and to advocate for them, particularly in the area that I work in. They are not backdrops to our stories, to our PowerPoints. We're privileged to share their stories, and we need to act like it. And the photos you'll see on the left-hand side, some of you are maybe too young to really remember them. Every now and then on the internet, they'll pop up. But these are the images that I grew up on of Africa. And not only are they not fair stories, not accurate stories, but what story are we trying to tell with that, those images? And what's that based in? And then you have the images on the other side. One of the commitments Pathfinder made, and I know a lot of other organizations have done too, but I'll speak for Pathfinder, is that when we have images of women, men, people from around the world in our work to show and tell their stories, we will have their names with it. We're really quick on photo credit, but we're not really quick on credit of who is this person and where are they from, because they are people. They, again, are not backdrops to things that we're trying to do. So if it is Lydia from Burkina, and we have access to use her first name, and we will always show her country, because there is a difference between showing a photo from Nepal and to show a photo from Bangladesh. And we want to make sure that we're doing that, because it adds to the dignity of the stories and the people's stories that we get to tell. And again, it may seem really small, but it's a reminder that these are people. These are not just, numbers or things that we're doing. We also want to create opportunities for diverse voices, not just ethnic, but experiences, backgrounds, education, country of origin. It adds a lot to the conversation. And I talk a lot about, from my experience as a Black American, of being from a working class family, my experiences are very different from those other Black Americans. But we need to all be a part of the pipeline of those who work in these fields, and how we tell our stories, because we add so much value to the conversation. Next slide. Supporting organizations that commit to diversity. Many of you will go on to great jobs in foundations, private sector, or even government agencies. And financing and investing in those organizations that are led by people of color are important. The numbers you'll see in that philanthropy article on the right side, that they say that people of color-led organizations do not get the same funding as those led by their white counterparts, and they're given more oversight. So that just tells us that, things are not equal. We still need to do better in the philanthropic fields. And again, you're the future. You're going to help change that, particularly the private sector, as they are more and more engaged on issues of global health. The other thing is about speaking up. It is important. Some of you in here may be allies to this space on issues of race, but it's still important for you to speak up. One of the things that I've learned along my career is how important it is to speak up for my colleagues. And now that I'm in a position of leadership, to make sure I'm speaking up when I think things are done wrong. Now, that doesn't mean I'm always going to change, but I'm going to add my opinion to what's being put out there, and reminding people that people of color, particularly in this field, can talk about things other than race. And you'll see in that photo on the left, we're talking about global health security. We can talk about digital health. We can talk about all different types of things. We know that because it's fewer of us, that when issues of race come up, we are part of that conversation. And I'm happy to always be a part of that, but also recognize that we add value in other spaces too. We do a lot, and we should be a value for that diversity of our work, as well as for our ethnic pieces of the puzzle. And I will say one quick story about being a good ally. And being a good ally knows when you need to speak up and when you need to fall back and let someone else speak up. So a few years ago, I was working with Uganda, working in the country a lot through my organization, and there was an anti-homosexuality law that was put forth. It was pretty well known, probably one of the most barbaric in terms of penalties for homosexuality in the country. And even at the time, President Obama spoke out against it. And the organization I was working for did a lot of work in Uganda and really wanted to put out a statement. And they wanted LGBT members of the staff wanted to put out the letter and sign on to it. And at the time, I felt like, why should it just be the LGBT members of the staff? We all can speak up and say this is wrong. And so, I spoke to my supervisor, and she seemed very surprised. She was like, well, this is kind of a gay issue. And I was like, this is just a human rights issue as far as I was concerned. But I'll say that to say she didn't expect people who weren't a part of her community to speak up too. And I think that we now know, after Tuesday, you hear people say, it is nice when someone else says it. You all know that this is wrong too. Why am I the one who have to speak up and say, discrimination against Asian Americans is not okay? And, discrimination between those in the LGBT community is not okay. It should be others who do that. And so that's an important role for allies. On the flip side, I will also say sometimes being the best ally means stepping back and letting others tell their own story and speak up themselves, and you just be there in the background. So ask. You just have to figure out what's the best role for you as an ally. And it's just really important. The other thing, keep educating yourself. But remember, your colleagues aren't responsible for being your teachers. This is something, now your friends can be your teachers, and they should be your teachers, but you're necessarily your colleagues. You have to constantly keep pushing so that you learn more. And one of the images I have up here, that's one of my favorite, is on awake to woke to work. And many of us, we've been awoken, or we're awake to these issues. A number of us are woke on these issues, but the work, that's where it needs to be done. What work are we doing so that we build, race equity culture that permeates in our universities, in our work, and everything we do and what we talk about overseas? This is really important. And this is, a book that I read myself. They have webinars, they have different things that they're doing to help organizations. And the fact that organizations are even thinking about those things really makes me feel good. It feels like that maybe this change will happen. And then you'll see the piece from DevX about what will it take to decolonize global health. The fact that DevX is, one of the leading publications for global health, and they are continuing to push and say, are we doing enough? And what are we doing? And who's doing it well and who's not, I think is a huge change. So I'll end with saying, we started this conversation on how we reimagine global health to include diverse voices. Today is a great start. I hope we keep having conversations like this one. I really want people to be okay with being uncomfortable. Sometimes you're just uncomfortable, but it's going to make us better. It's going to make our community better. It's going to make us have better impact on the work that we do. And it's going to frankly make us better in the world for ourselves and others. So thank you again for inviting me. And I am really looking forward to some questions.
All right, so now we'll be moving into, so now we'll be moving into the Q&A portion. So we do have a chat function down at the bottom below. And if you have any questions, you can type them there and we'll read them out loud. And so first, I'll start off with David Kang. So first of all, thank you for shedding light on the issue of diversity in global health. But for some of us who are just learning about this field, can you share some examples of how this problem has manifested in the field? Or for example, how there are almost no advisors of color in the COVID response, despite that Asian Africa have so much more experience dealing with pandemics?
Yeah, great question. And it really comes down to two things. So one is many times the people in decision-making capacities are not people of color. And it goes back to what I said is I distinctly remember one job where there was one director of color and his staff was diverse. I mean, ethnicity, backgrounds, it just was amazing, ages. It just was automatic because for whatever reason, people of color tend to know other people of color. And so, or maybe because we're just used to having to reach out and find others, our field our network tends to be more diverse. Until we find and do better with diversifying those leadership positions, it's going to be difficult to see what we want to see on the other side. And I would say this is something particularly the Biden administration has committed to doing. A good friend who used to lead the Global Health Council is now running the Office of Global Affairs at HHS for the administration. That was a huge deal. She is the first woman and the first person of color to serve in that position. And she's a younger woman. She's the youngest person in there. So we see that this can change, but frankly, calling it out too and saying, this is unacceptable. Where are the people of color? Where is the diversity here? And I really mean, calling out. We didn't have Twitter when I was your age, and Twitter is a powerful force. If you've seen, was saying we're not seeing what we want. That's direct access, and frankly, we need it. We need it if we want to see change, and we also need to put forth names. It's before you be like, oh well, I don't want to put forth someone's name yet. No, give them a name. Say, here's some people you should be thinking about. These are people who are important, who have facts around these things. And it may, again, seem like, why don't they know it? But until they know it, if you put forth those listed names to them, then it can't say, I don't know where to find them. And that, frankly, is important for jobs, internships, and anything else. The people who get jobs are people who had internships. And in this field, up until a certain point, the people who got internships were able to work for free. Now that has changed. Now, everyone has a paid internship. That's only been in recent years. So that means that, people had to self-finance, being able to work in Washington or Boston, in these places where they may not have had a place to live. These are expensive cities to live in. But now, we have paid internships. But people who get internships get the jobs. People get the jobs, get the next level up. And that's how things happen, particularly in our field. So I'm just really calling you to say and speak out on these things, make recommendations, and keep pushing, because there's still positions to be had. And we want to see more of that. And once we deal with COVID or get it under control completely, there'll be another global health security emergency, because there always is. So the next time out, let's get it right the next time. Let's talk about planning for the next global health emergency. Let's talk about, frankly, who's in Congress and who's working at those for members of Congress on their staff, because Congress has an important role to play in all of this with the funding, and who's at USAID, PEPFAR, these agencies that are lead, and CDC, who lead the US response on these things.
Thank you. And the next, we have a question from Amber Ali. How do you expect the global health landscape to change now that we've begun to put diversity as a focal problem and are hopefully moving to more inclusivity in the field?
Yeah, so I really hope, honestly, I really wasn't just saying this. You all being such a diverse network, putting this together shows, one, a lot of fortitude, and but it also shows the power that you see yourselves in your collective voices. You are the future. I mean, people say that all the time, no, but you really are the future of global health. And so what you demand to see is what we're going to see. Because again, if you are saying, we're not seeing diversity here, then people will react and say, oh yeah, you're right, we have to get there. The role of HR and recruiting is frankly one of the most powerful pieces to all of this. Because again, if I don't know people of color and I use a recruiting firm that has no people of color working there, likelihood of getting a person of color there is pretty low. I will also say that I have never, and I can say this firmly, I have never got a job that I wasn't overqualified for. Never. I expect that I have to do better. I mean, it is what it is, but I will say that even when my colleagues have said to me later, like, oh, I didn't realize you had already had all that. I mean, there's jobs where I was required to have a master's degree. Colleague who got the job after me was not. That was just considered the norm. You just had to be a little bit better. I don't think in this day and age that could happen the same way, because one, you all know your power a bit more than I knew my power at the time. Two, you have social media to call out things when things are not right. And three, I do think there's a more conscious effort for leaders to say, we need to do better, and not just say we need to do better, but actually do better. I'll say one more thing is that I'm really proud. Like, I worked at Pathfinder International, and I said in another presentation that it was the first time ever that I was on a leadership team with another Black woman, ever. And how proud I was. I was really like, wow, Black women in leadership positions. And it was, that's sad to say, working in this field almost 25 years, but it was powerful. And because it didn't feel tokenized. It wasn't like, we got one checkoff block here, one person of color here, one woman, oh, one Asian woman, one Black woman. It was, we're going to have a diverse team of people to bring forth the best that we have. And I think more people are recognizing how important it is to have that diverse team. You all are going to be the ones to hold them accountable for that. Because again, nice words, we want to see action and continue action.
All right. And then next, we have a question from Shamila Jivraj. How do we join global health initiatives, and what organizations are going out of the recruit? And just a question for myself, adding on to that is, just as described, the field can be quite difficult and competitive to get into. How should we get a start?
Great questions. I will say there's three things that I would recommend. One is figure out if there's like a region of interest for you and kind of go in that direction. I would say internships are incredibly important in networking. And I know sometimes, I mean, I think you all get the networking more than, again, like I said, I got at the time. But the networking is important, because if you reach out to me and say, hey, I met you at the conference, I heard you, this is what I'm interested in, the likelihood of me remembering, oh, here's an internship I got, or here's someone hiring for entry-level position, and passing it off to someone who I've met at an event or a virtual event in the last year, that will come up more and more. The other thing I will say is think about global health has a lot of tentacles to it. So as I was talking about, I work in Washington. So global health also includes all those congressional committees and different things like that. It also includes working at a university and their departments. It includes working at NGOs, private sector organizations. What listservs like DebEx, Interaction.org's website, Global Health Council.org's website, all of them will always have entry-level positions, junior positions in global health and development. And don't limit yourself. Like the first internship I got, I told you, was more working in Chile, exactly kind of what I wanted to do. Then I worked at a hospital, and I was like, this is not what I want to do. But it was a good internship for me because I recognized what I didn't want too. So don't think that everything is going to be something you fall in love with. Something you may fall in love with temporarily, or you may say, I really don't like this, but you get to cross it off the list and say, what I really want to do is this. But having those diverse experiences really will help you to get to, one, your career piece, but also will help you with meeting more and more people to be a part of committees and different things like that and organizations.
And we have one more anonymous question. Aspiring physicians or workers on the ground and people who won't be starting in positions of leadership or influence, what changes can we bring from the bottom up?
Great question. One of the things I talked about being a good ally and paying attention. Something that happens at jobs now a lot more is kind of like people at the same level will kind of talk to each other about things. I mean, frankly, it was junior staff people who were the ones demanding pay equity and saying, we want to see what everyone makes to make sure we're, being treated and paid fairly. I mean, that was amazing and wonderful to do. But that was that group coming together to say this is important because, again, it's strength in numbers. I will say everyone has power. And a lot of that power comes from the networking together. Mentors are extremely important because a mentor can say, hey, that's not right. Who told you that? Or what did they say on that one? Or that's, a great opportunity. Take advantage of it. We'll figure out how to find you some funding to do it. So one is saying a lot of yeses to things. Two is being a good ally. And the other thing is speaking up when you think something is wrong. And it may not be to your supervisor if that is someone who may have the problem. It may be HR, or it may be somebody outside of the organization to say, this happened at work, it may be uncomfortable, or I saw this at work, it may be uncomfortable. There's a lot of power in that. And being a part of organization and networks that take you beyond your college years. So those things that are maybe global. I'm a member of Rotary International, and the cool thing about Rotary is because it's people all over the world. And many times there are Rotary grants and different things that will allow you to go places. But Rotarians are very lovely people. They will invite you to their homes and say, just stay here for the next month or something. I mean, it's amazing some of these networks you can be a part of where you can see other things, but they also can help you with maneuvering and getting to other positions and other opportunities. So being a part of other organizations will help quite a bit, but don't, just because you're, that entry level coordinator or maybe a new physician or something, doesn't mean you don't have power. You really do. And let's take advantage of that power as much as possible.
All right, and then we have time for a few more questions from Professor Brooke Baker. First of all, thanks so much for the focus on diversifying and decolonizing global health. But I wonder how much more we have to emphasize partnerships with the populations we work with, bringing them into policy discussions and decisional roles, and making sure that their assessment of global health initiatives and program are taken into account and lead reform as needed.
Yeah, well, literally what we do every day, right? That is perfect. So I will say this, that's where the work still needs to happen. It's a little bit better. So I will say, I'm a part of the Frontline Health Workers Coalition on their steering committee. And one of the things we did under the diversity initiative is we said, we want to put together a speakers bureau of frontline health workers around the world. Because again, one of the things it comes back to, many times people say, I don't know where to find people of color. I don't know where to find fill in the blank. So you know what, we're gonna help you find them. So here's a list of them with videos, with their contact information, country of origin, language that they speak in, websites to find them, so that you don't have to look. Here is the list. So all of these members of the Frontline Health Worker Coalition can identify and find those people right away. And these are things that help build the movement. I will, as far as making sure that we are inclusive in the voices of the communities where we serve, that is something that I think is getting better, but still needs a lot of work. And a lot of that will come from the organizations who are working in the field and doing the direct service implementation, and frankly, from the funders who are funding these things. It has to be, the time has to be allowed to bring in those voices. And it's just not a 5-minute thing. It's not like, hey, send a proposal over to country X and have them review it. That's not input. That's not a dialogue. That's not a conversation. That's a review. And I feel like we lean toward more review than active, authentic participation. And authentic participation means that it may be a little slower, but you get to a better product. I think the consciousness has been raised that we need that authentic conversation. I don't think we still do it enough. But it is slightly better. I will say again, for an organization like Pathfinder, we have moved toward a much more global model. There is no HQ US and the rest of the world. It is all the countries are equal footing. Our country directors have their own leadership council. They make the decisions about what happens in their countries and projects they want to participate in, and how they tell their story. Many in the US staff are support to their work versus the other way around. And that may seem really slight, but that's a huge difference because the work is happening in Asia and Africa. It's not happening in the United States for international NGO. So it's important that we remember where the power really is and that we support that power rather than think we're in charge of them. And that in itself is a huge change that a lot of organizations are undergoing. And so I said, we're moving along. I think the larger systems will have to make some major changes to do that. And I see organizations starting to move in that direction.
All right, thank you so much. We have time for 2 more questions. And so one will be, so the first one that I have for you is, what's sort of the best advice that you've received from a mentor or that you might have for us, for all of us who are aspiring to work in the field?
Well, the best one I feel like I didn't take advantage of, but I got was learn French. I know it seems really basic, but it is, Francophone Africa is, for me, such a cool place to work for all the bells and whistles, but it's such a wonderful place to work because I understand enough to get to listen to my colleagues talk about what's happening. But because our field still is very Anglophone focused, they're left out of some of the bigger meetings and the bigger conversations. And so when you get to tippy toe into the world, it's like all this stuff is happening that just isn't, just because of language ability for the US side of it, it's just left out of the conversation. And so at Pathfinder, we work a lot in Francophone Africa. And so I've done a lot to raise, I host events now that are French, where I have to listen to the translation versus the other way around. Do you know what it's like to have, panels of these experts around Francophone Africa talk about best practices to one another in French, organized by us, as opposed to them listening in to us from Anglophone countries talking about the work? It is a huge difference. And when you talk about diversity, language is a huge barrier for diversity and inclusion. So for me, being able to participate in a lot more conversations with countries around the world by learning French is a huge factor. And we also work in Mozambique, so Portuguese is another big one that is a factor. The other thing I would say is it goes back to saying yes to things. I remember, and now I may sound like a crazy person, now you hear me tell this story. I remember getting an opportunity to go to South Africa, and I was like, no. As a student, I was like, I don't know, it seems kind of far. Who turns down an opportunity to go to South Africa funded? No one does. You probably are all thinking you're crazy. But at the time, I was nervous. It seemed so far away. Instead of being like, just yes, suck it up. You'll be fine. Whatever it was, whatever fear I had, I was going to be fine. It was through a university program. They were going to, make sure we're okay. But don't let fear hold you back. Say yes. Say yes to the opportunity and take advantage of every opportunity you have. Even if you come out saying, you know what, I hated doing that. Again, just check it off the list of something you're not going to do in the future. But say yes to those opportunities and get out of your comfort zone, because you'd be amazed at what happens when you do. And, I was lucky enough that later on, probably 10 years later, I got to go to South Africa. But I really missed an opportunity there at the time because, frankly, I just was nervous. And I didn't know anyone going on the program. Well, I can make a friend. It was okay. So I will say the biggest advice is that. And then one last piece of advice I'll have is to keep in touch with people. One of the things I do really, really value in my life is relationships. It's a part of my work, but I value authentic relationships. And staying in touch with people is not quantity, it's quality, but staying in touch with people and staying connected will help you in this field. We are a very small field, as much as it may look big. very small field where people are always connected to another friend. I have people who I worked with from years ago who will ping me and say, there's a job there, I'm interested in, can you tell me more about? Or my daughter is looking for a job, and she saw one on your website. And people, feeling comfortable enough to reach out and say that, and you say, this is a great opportunity for her. Or, you know what, this is another position that I saw that may be even better for her. So, those staying in touch with people, being authentic, is a big part of what's going to, I think, carry you really far.
All right, well, Ms. Lander, thank you so much for joining us. That's all
My
the time
pleasure.
we have for questions. But feel free to whisper her any more questions you might have in chat. I think she would be happy to stick around for a few more minutes.
I will.
But in the meantime, it's been such a pleasure, and I'm sure your remarks will be valuable for many of us trying to work in the field. But speaking of change, we have a very special panel